Well, welcome everybody to the Debrief with Kendal Bailey. I am always very, very excited, but I love connecting with other individuals that are really expanding the nursing profession through love and support. And today I have Dr. Morgan Taylor, who is the Chief Nursing Officer for Archer Review, here for the discussion. And what I love about everything that I see that she's doing is she is adamant about nurses, developing nurses, and getting the nursing profession to the next level. So, Dr. Taylor, thank you so much for joining us today.
Thank you, Kendall. I've been looking forward to it all day. This is going to be a great conversation.
Well, I was just joking with Dr. Taylor about how we're going to be talking about mentorship today. And I think she should become my mentor as she already has her own podcast and what she's doing in the nursing community. But I always like to ask, how did you get into nursing? You've been a critical care nurse, you've worked in pediatrics, you're a nurse practitioner, and now you're the chief nursing officer for an education company. How did you get to this pathway and what did nursing look like for you?
Yeah, great question. And I always preface this answer by saying none of my plans have ever worked out. I have never taken the path that I thought I was going to take. So I'll back it all the way up for us. Starting out, middle school, high school, even late into high school, I thought I was going to be a ballerina. And not in a I'm 5, I want to wear a tutu way. Very much was training classical ballet, wanted to dance for the New York Ballet. I then had a really bad back injury that took that possibility off the table. So from there, I was like, what's accessible to me? What options do I have? I wasn't really planning on going to college, so I had to scramble and figure that out. And nursing was something that had always semi been on my radar. I had a lot of family members that were in the healthcare system in different points of their lives. My younger sister was someone who used the healthcare system quite a bit. So I had been exposed to it and thought, okay, I like being involved with people and using my hands. I don't want to be sitting behind a desk. Let's go for nursing. Nursing sounds like the way to go for me. And then once I started down that path, I totally fell in love with pediatrics. I've always liked kids. Kids are just way cooler than adults always. So much more fun. But getting into pediatric medicine was so fascinating to me. The things that kids can recover from, that adults just never would, the resilience, the stories that they have really lit me up. And I knew pediatrics was going to be where I really wanted to land. And I was very lucky that I was able to work in several pediatric areas. My first job out of nursing school was at Duke University Hospital in a unit called the Children's Resource Unit. They called it CREW, which was basically float pool, but only for kids. So I floated from the PICU to the cardiac ICU to the ED, bone marrow transplant, NICU, all over. So lots of critical care, lots of emergency medicine, but all with kids. The only time I've ever done any adult medicine was during COVID. I got floated over to the MICU, and that was not my favorite. That reaffirmed for me that kids are the way to go, that I will always be a pediatric provider. I went through that. I put in quite a few years at Duke, loved it, but did want to advance to that next step and become a nurse practitioner. I started out, here's another point where I didn't go down the path I was going to. I thought I was going to, at least. I started out in a program that would have me certified as a dual pediatric and acute care provider. Really thought that I was going to be in acute care, critical medicine for the rest of my career. Loved the ED, loved the ICU, saw myself in that setting. But I had to do primary care first as part of this dual program. And when I tell you I fell in love with primary care, I mean, I fell hard and I totally didn't expect it. I thought that would be so boring after, kids on ECMO and ventilators. And it turned out I actually loved seeing healthy children. I was like, oh my gosh, not all the babies are sick. This is so precious. I get to watch them grow up. There are things that I can do early in life, interventions and ways that I can counsel these families to keep them out of the hospital and help them thrive and become these amazing little humans. And I ended up dropping that acute care certification and just being a pediatric primary care nurse practitioner. So, and that's where I've landed in the clinical side of my career is I'm in primary care. That's what I do now. Totally the opposite of where my nursing background really was.
Well, I love it. I will say everybody who's out there, adult nurses, because, right, I think this is why Dr.
Yes.
Taylor and I get along. There's like special scopes for each specialty, which is why I like nursing. I am not an adult person either. I remember a very vivid ED clinical rotation and me walking out at the end of the day being like, nope, this is not for me. I
Not
don't
for
like,
me.
I'm meant for little people, not for big humans. So there is a nursing specialty for everybody out there. And
Yes.
I very much bless and love those for all of our different scopes and specialties. But honestly, with a very non-traditional path, I remember I entered pediatrics because I had an amazing faculty member who said, you should be a NICU nurse because I thought the same thing. I should be critical care and I want adult ICU. And they're like, no, 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 no. We see you in the little people world. And I fell in love with it. So during your journey, was there mentorship and those opportunities that helped made those decisions for you as you were, getting exposure to different clinical areas?
I'll be honest, not as much as I think there could have been. I had excellent faculty members. There's, a couple names that pop into mind, but nobody that really took me under their wing and helped show me how much there was out there. And that's part of what makes me so driven to incorporate mentorship earlier on in our academic journeys, our nursing journeys, however you want to phrase it, because there is so much out there that I had no idea about because there really was no one guiding that path.
So that's where your passion now is. And is that the work that you're doing with Archer is really supporting and mentoring new nurses?
Yeah. So I'll back it up a little bit because there's some overlap in how I got to the seat I'm sitting in now. And it started while I was still at the bedside as a bedside emergency department nurse, but getting to the point where I was doing a lot of precepting, where I was doing some clinical instructor, working with those students who are about to graduate to those brand new nurses, which is such a special time. That's still the student that I love the most. I love working with those new nurses. But what I was seeing firsthand was these nurses were coming into a very acute emergency department without some of the baseline skills that they really needed to be successful. Layer on top of that, in this particular unit, we really didn't have a good wraparound support for how to ramp them up over their first, really their first year. Let's be honest, it takes a long time for us to become competent new nurses, but especially in those first 90 days, when you're brand new and it is so scary. So these nurses ended up leaving us faster than they were coming. And that led to me doing a lot of rinse and repeat, try to teach the same thing. It just felt so ineffective, Kendall. I was like, I feel like I'm wasting my time. I'm failing these nurses that could be great, but the whole system is not supporting them in a sustainable way. And that was when I started to take a step back and think about what systems are already out there, what's already going on, and what maybe could we tweak and adjust. The nursing education system is very strained for resources right now and has been for some time. So I really started digging into what was there. And that was when I connected with our founder, Karthik Kuduru, a wonderful medical oncologist who was seeing a lot of the same things in the medical side and was looking for a nursing counterpart to come start building some support systems. I'll be honest, I didn't totally know what that was going to look like at first. And again, I didn't ever plan to be in education or be in leadership. It was not, on my radar. It was more a response to here's what I'm actively seeing. And then let's start to dig into it and problem solve together. So that was where Archer got started. I think I've shared with you, Kendall, it started in my closet. That was the only little space I had carved out to work for that. But the acoustics in there were quite good. So I was recording videos and doing webinars and writing questions. And it started off with how do we help nurses pass their board exam, that NCLEX, RN, or PN examination. It's this major hurdle. It's so stressful. And, people just look at it as this roadblock, like I have to get past this barrier. And they put so much stress behind it. The whole weight of the world is on your shoulders when it comes to passing this exam. I've had students tell me that they feel like their whole worth is tied to this one exam. So that statement in and of itself was, to me, the impetus for let's start here. Let's start with making this more accessible, less of a roadblock, and more of another stepping stone on my nursing journey. Let's build these students up, build a community around them so we can get them across the finish line. And hopefully, if the finish line is the NCLEX, day one of your new job, you've actually got this skill set that's going to set you up for success. So long-winded answer to that. I could probably just keep talking for another hour, but I'll give it a rest here for a second.
Well, no, it's guided from passion, right? You can tell that you have the passion around what you do, and we need more individuals who have that passion. And that's why I love talking to people like you who have that. I really like how you talk about, you and I have been in healthcare for a while now. This is not new for us. And I will say, even my own experience, however many moons ago, which I don't need to bring up, I felt like my foundational skill set in both my NCLEX and as a new nurse really came from those nurses like yourself who guided me and developed me and really supported me in both that new transition, but also skill sets I've taken across my entire career. I think I struggle a little bit, and I don't know if you've been hearing this lately, is so many times I hear, oh, our new nurses aren't prepared and they're not ready to enter this healthcare environment. And, we have this high turnover rate because we're not prepping them. But I'm curious to feel like if you think is it the prep, or is that we just don't have, like you said, those support systems in place to get them through what I also considered a stressful time, however long ago.
Oh my gosh. And I mean, let's be honest, it is going to be a stressful time. I think it is totally okay to acknowledge that. I think there's a difference between it's a stressful time and my entire worth as a human being is tied to this one outcome. And if we can diffuse that a little bit, validate, build them up as human beings, that's actually going to relieve at least some of, not all, but some of the stress around that specific benchmark. So I think that's where mentorship from day one comes into play. Archer Review starts with the day you decide you want to be a nurse. You want to get into nursing school? Let's prep you so that you're ready to, do well on your entrance exam, but also just start off really strong in that first class. We start everyone off with Nursing School 101. That is honestly basic stuff, but if you can master and kind of get your head wrapped around the communication, the time management and planning, the study skills, the testing strategies, you are so much better prepared to actually get all of those tough concepts out of your really hard classes and then be able to critically think in the way that's going to push you forward throughout your entire career. So we really have to look way further back. And I think that's really hard to do if we don't have role models and mentors kind of lighting up that path for us. If everyone else is just, kind of drowning in this sea of anxiety around all these exams and et cetera, we're going to as well. So we've got to have that mentorship in place.
Well, I'm going to ask the question that gets asked a lot, right? Many nursing students go to school and they have preceptors and they have individuals, they work with experienced nurses on the floor that are guiding them. So where's that difference when we talk about preceptors and what you describe in mentorship? Because my understanding is those are very different things, but a lot of times we cross over those terms and they're different.
I could not agree more. And I think I had the misperception that okay, you've been assigned to me, whether I'm a student or a new nurse, to be my preceptor for the day. That means you're my mentor. And that is not the job of a preceptor. The preceptor is there to oversee and ensure you are safe and teach you the skills needed for the job. So let's take, for example, I'm starting out day one on a cardiac ICU. Their job is to make sure I don't give anything incorrectly. I document everything. Their license is on the line for all the actions I'm taking. They're going to make sure I'm titrating the drips, this, that, and the other. They want to get through that shift and make sure I have the skills. Mentorship is about a lot more than skills. Mentorship is about who you are as a person, where you are now, where you want to be 5, 10 years from now. and what we can do to build you up to get you there. I also think it's a two-way street, which preceptorship isn't necessarily. It can be in some regards, but overall, the preceptor is again conferring those skills to you. With mentorship, you're learning from each other. There's a ton of things I learned from people that I mentor because there's always something new coming up, and it's amazing what you can learn when you have an open mind and you're having those conversations. So that being said, I am a big advocate for having multiple types of mentors in your life. I think you need to pull mentors from different areas and different specialties, different phases of your life, because they're all going to have a little bit of a different perspective on where you're at and where you're going. And they'll be able to connect you to different resources depending on the setting that you're in. I've got a great academic mentor that I did my doctoral work with that really helps me with publications and speaking. If I need to write a grant proposal, she's who I'm going to go to. But I have a different mentor who I talk to about leadership skills. I'm now in a seat where about 40 different people report to me. I never trained for how to lead an organization. So learning that from an experienced leadership mentor. They have very different skills and they complement different aspects of what I'm trying to learn as I go along this journey.
I like that you bring that up because I will say what I see a lot in academics, especially as you talk about the resources that we see here. A lot of times, right, we're clinical experts and we enter academia, or we are clinical experts and we enter leadership. And I see, and I wonder if you've seen this translation as well, especially in your personal life, that mentorship is essential throughout the entire lifespan of your scope, whether that's your first introduction to the clinical area or my first leadership position or my first academic position. Have you seen that same translation with others, that this is not like a one and done, I'm a new nurse and now I'm good, that there's really several entry points across your career?
Absolutely. And I love, Kendall, how you bring up there's several entry points because it reminds us it's never too late to get started. If you don't have a mentor and you're like, well, I'm already 10 years into my nursing career, what's done is done. No, what's done is not done. You have plenty of time if you see yourself expanding your role or you just want input. You want someone to bounce your ideas off of. Never, ever too late to get a mentor. So then the other thing I always say, in addition from we want to have mentors from different areas in our life, different times, different perspectives. We also have to have a plan about how to leverage those mentors. If you just have a checklist of all right, I've got a professor, I've got my preceptor, and this person I really look up to. Great. Done. I've got my mentors. You're not really going to get a lot out of that relationship if you don't hold yourself accountable and use those relationships. It sounds silly, but hear me out. You need to regularly engage with those individuals at least quarterly. At least quarterly, sometimes monthly, maybe depending on your relationship. And you need to go to those, think about it like a business meeting. You're like, here's what I've accomplished. Here are the questions that I have. I need your feedback on X, Y, and Z. Because if you don't take that initiative to really drive that conversation, tell them what your goals are, they're not going to know how to help you. They're not going to know, oh, I have this contact over at this university that Morgan should really be talking to. I didn't know she was interested in that until she brought it up as one of her goals. So, I always talk about I've got outlines and different, meeting note templates that you can use to plug that in and make it more natural. But you really do have to prepare for those meetings as if it's part of your business.
So you talk about a lot of positive experiences. And I will say, as someone who has a color-coded daytimer, I'm very much into this schedule routine. Oh, everything is a highlighter color. I think I have the entire spectrum. Have you ever had a bad mentorship experience?
Yeah, absolutely. And I think that's great to bring up because you can often end up feeling really dejected and down if it's maybe not a great experience. And I will go out on a limb and say, I think we have a lot of preceptor situations where we maybe don't mesh with that person. Or let's be honest, it was just a super hard shift. And you're like, okay, well, that person hates me. I'm never going to have a mentor again in my whole life. And it's just really puts you down. I think it is very normal to have those experiences and just acknowledge like not everyone is a fit. So if someone says, no, I don't want to be your mentor, okay, that's fine. If somebody really isn't clicking with you, all right, they're off the team, no problem, no hard feelings. They'll be a great mentor for somebody else, just not for you. And then you can connect better. I know for me, I really, really value somebody who will get back to me, even if it's, hey, I don't quite have time right now, but let me reconnect with you in a month or whatnot. So if I have somebody that isn't really great about communicating, that is not a good fit for me. So I'll have like the undergraduate professor that I really looked up to as a NICU nurse was somebody who just didn't have the bandwidth to get back to me when I needed something. So that was not a good fit. She was perfectly lovely, but it wasn't a productive mentorship. So I think that is absolutely essential to recognize and don't take it as a sign that you don't shouldn't be following mentorship. Just move on and find the right fit.
Well, I think that's right. Not all mentorships are going to be this like beautiful, magical, like growth experience. And honestly, it might be, I will say there are probably a couple of mentors in my life where I was like, yeah, maybe that's not what I'm going to do in my role. Like maybe that's not my style. Like we're not really blending with that. So it might also be that converse side of that's not part of what I want to do. But I like that perspective of it's still a learning opportunity. It's still a way that you're going to grow and continue to develop yourself. So we know mentorship is great, right? We can see there are studies that say mentorship reduce nursing turnover, increase retention, help increase, decrease burnout, increase resiliency in nurses. But mentorship is still, it's not really a common theme, at least in my perspective, across that like nursing lifespan. Why do you think that is? Why have we not like fully adopted this through like curriculum, through your new nursing experience, all the way up through the entire like nursing spectrum?
I think it's hard. I think it's time consuming. It takes a lot of resources, both in time and money. We have to commit to it because it's, again, a two-way street. I've seen some programs who will try to put together, you match with a buddy and this, that, and the other, but only one party ends up really being committed. So it kind of just crumbles and falls apart. So, I talk about these beautiful experiences like they just happened, and that's not really doing it justice. It takes a lot of elbow grease. And I think our programs are already really strapped for resources, which makes it a big challenge to implement something like a robust mentorship program from day one.
So, right, you said it's a lot about the relationship building, which takes time, right? To have a relationship with somebody, you've got to put in that investment on both sides. So how is an organization, I'm assuming you connect with nurses all over the nation, if not the world.
Yeah,
how
absolutely.
are you making those relationships with them to grow that mentorship through Archer and the work that you're doing every day?
Yeah, absolutely. So we start off our mentorship in two different ways, knowing that different people have different needs. And I think that's essential, a good takeaway for any sort of mentorship program. Having kind of different levels of involvement or time commitment can make it more attainable for everyone to be involved in one way or another. So we have some students who are really in need of someone to hold their hand, be their cheerleader, and walk through this journey with them. So for those students, we have a 6-week program where they join, they're assigned to a mentor. That mentor helps set them up with a schedule of, hey, this is what we're going to tackle based on everything you've gone through with me. And we have every Monday and Wednesday where they're checking in face to face over Zoom, as well as getting, we do like a video once a week where we've reviewed all of their scores and their progress and given them kind of customized feedback based on how their week is going. So over those 6 weeks, you're seeing that person, you're getting to know them. You're like, their kids are running around in the back. They've got to go get their dog, like all those things on a personal level that make up the messy soup of who we are, funnel into that relationship and make it much more productive. The consistency of showing up every week for those 6 weeks is a big part of forming that relationship and, kind of launching those students off into their next chapter. So that is one really, really great program, but it's not for everybody because not everybody has those, dedicated 6 week blocks of time. So our other model is simply a la carte. We've got kind of a bench of different instructors, mentors, tutors, whatever word you want to use, where you can kind of see what their background is, learn a little about them. And then what students will do is they'll book just a 30-minute like intro, I want to try you out meeting. We like to do a little sampling, right?
A little adult dating, if we will.
A little adult dating, a little mentor speed dating here. Hear more about them, let them hear about you. And in that first meeting is when we'll draft a plan together. And that will look different for everybody, but it allows us to kind of build that a la carte mentorship based on the student's needs, where they're at in their journey, etc.
Well, and you have probably then, I'm assuming, a ton of mentors that are working with you.
Yeah.
How are they trained? Like, do you feel like mentorship really needs to provide formal training to those that are mentoring? Is it somebody who's really passionate about their position as a nurse and, expanding healthcare? What is that framework to become a mentor, right? I think all the time I have that sweet little thing called imposter syndrome, like many of us, where I'm like, I can't mentor anybody. I have no idea what I'm doing, but I do find myself in that role a lot. What is that translation to you? How do we become the mentee to the mentor? And what does that look like as we grow this hopeful relationship amongst our community?
It's such a good question. And I'll tell you, my answer has changed over the past 5 years. As I started this, I dove in feet first and figured it out, built the plane while I was flying it. I heard so much input from students who needed this, that, or the other that I started to build my playbook of, okay, this worked, that didn't. Well, that actually didn't work for this student, so maybe that wasn't as generalizable as I thought it was going to be. And really started mapping out what are the common threads, what are students struggling the most or the least with, etc. It very quickly outpaced what I myself could do. So I started bringing on other nurses, and I'll tell you, Kendal, at first, I'm like, just jump in. I have this horrible quality where I assume everybody can just like jump in and read my mind.
I might be a similar human in that.
Apparently it doesn't work like that, which really taught me, okay, all of these little notes about this, that, and the other, these themes you've been collating for the past years, we need a formal playbook. We need to take all these learnings and build a mentorship playbook. So our handbook is about 60 pages long, and all of our mentors go through this training where they do the kind of see one, do one, teach one type thing, but it's built upon this framework where we have essentially studied what students have most needed, benefited, not benefited from, and layered it on to this structured plan. So all that to say, I have totally changed my tune to, just jump in. To yes, we absolutely need structured training. I feel the exact same way about leadership. We promote people who have like amazing clinical skills, and we're like, great, go be a manager. And then you're like, I don't know how to budget and what's head count. And it's like this whole new set of skills that we don't always train our leaders for. So with all of that to be said, I do think we have a lot of room for improvements in how we support our mentors and leaders in their training.
Well, and me, I think where we bond, we're both innovators in education. I'm, a sim enthusiast, sim lover, anything about, experiential learning. Do you have that as part of your model, or see a benefit there of using simulation to help promote mentorship or these conversations or the growth of these relationships? Do you see anywhere where maybe looking at different educational strategies might be a beneficial way to develop the skill sets?
Oh, that's so interesting. I honestly have not thought about simulation specifically to mentorship. What an interesting idea if we could, debrief our simulation with our mentor in a simulated learning experience. There is so much data to show us how impactful simulation is to our learning. I'll be honest, when I was in nursing school, it was not a big part of what we did. I went in person, we were hands-on. We had a skills lab, but it was, it was all hands-on. It's very different from what we are seeing a lot of today. And there's so much data coming out to show us how impactful it can be. So I absolutely think that there's a place for it in mentorship and leadership leadership and growing our skills, especially let's think about nurses, managers, leaders who maybe work for rural or community access points that can't necessarily get into class or get into a skills lab, etc. Like let's bring the learning to them and let's make it more effective by introducing simulation.
Well, I know. See, I've always got to like poke the bear a little bit on like how can we, expand those learning
Yeah.
experiences. But I think you brought up a really beautiful point earlier about how you've learned from those that you have mentored. And I see this almost new translation of like a reverse mentorship, where as a faculty or a nurse leader, can I learn skill sets in nursing students maybe around tech? Or maybe around like new, innovations in healthcare that I might be removed from in my like current practice. Have you seen any models around more of this reverse mentorship of learning from this next generation and the skill sets that they can bring forward?
It's so incredible, is it not? And especially the speed at which healthcare, ed tech, healthcare technology is currently developing. I think we would be remiss not to be embracing that bidirectional learning that can happen in mentorship. I haven't seen models specifically built to support, train, and enhance that. I think right now it's very much a grassroots, like, oh, look what's going on. The students are telling me about this, that, and the other. For me, I hear a lot from students about how they're learning. The modalities in which they're ingesting information are very different. A cut and dry example is, 5 years ago, I could record like a 3-hour lecture on cardiac, and that was posted to our website. And students, they watched it at their own pace, they took breaks, etc. But going to a 3-hour lecture was very normal. I had 3-hour lectures in nursing school like 4 days a week. That was what you did, and no one questioned it. Well, it turns out our brains can really not handle 3 hours of cardiac. You do not want to hear me blab about the conduction system for 3 hours. You are going to tune me out, total cognitive overload. So how do we then take that information, pull it apart into nice bite-sized micro learning lessons that we can then use techniques like spaced repetition to layer on top of that and make the learning process more effective, so we're not just like staring at a screen for 3 hours and losing 80% of it. So how are they getting that information? They're getting it from social media. They're on TikTok. They're on Instagram. Can we create really short little bite-sized takeaways and deliver it to students where they're already spending a lot of their time? Can we reimagine our LMS platforms to get more immersive? Can we get simulation into our LMS platforms when we're teaching anatomy and physiology? Can we get our hands on it in ways that we haven't before? Because if we don't, we're going to lose this generation of learners. They are not going to come, to us with what we think they should be doing. We have to meet them where they're at.
Well, it's an adoption. It's a continued growth. And what we needed as learners as we were going through our nursing careers to even what our mentors and preceptors needed is very different.
Totally.
And I like the positive around this. This is not that anybody, it has a deficit. We have differences amongst learning groups, and we have to grow with that.
Yes.
So first question, because I'll lens it from the two sides. If I'm a student, and personally, when I entered the nursing profession, I didn't know a dang person to save my life. I had nobody in my nursing network to be like, hey, can I get to know you? I wasn't ingrained in the healthcare community at all. What would be the steps, or what would you do to encourage me to get into a mentored relationship? Or where do I even start if I don't know who those connections might be or that group to go through? Is it going through something formal like what you've developed with Archer, or do you see other pathways that they can also grow through that mentorship relationship?
There are definitely multiple pathways. If you absolutely don't know where to start, as I'll raise my hand and say I was one of those people too, starting with something like Archer Review can be excellent because it's simple. You only have to do one thing. You sign up for that 30-minute little intro session and we figure it out with you. We can give you a plan from there. So it takes some of the stress off of you. You don't have to, work quite so hard. We can help make that first step easier. The other thing that I will say, and if you come to a mentorship meeting with us, this will probably be part of our recommended plan. Get involved in your professional organizations. If you're still a student, NSNA, the National Student Nurses Association. Get involved in your local chapter, your school chapter, your state chapter. The American Nurses Association. I'm very involved in my state chapter. I find that the big national organizations you can get lost in a little bit. I have built amazing relationships with those in my like state and even district chapters because they live right around us. You end up going to get dinner with these people, and then you have no idea who they'll connect you with. It's usually very affordable to get a student membership to these national organizations and state organizations, and it's a great place to start. But I'll caveat it with this. You can't just join and then be like, okay, I did what Morgan told me to do. I'm good now. I've got mentorship. You do have to put in the elbow grease. You have to go to the meetings. You have to show up. You have to ask the questions. And once you start showing up and asking the questions, it will take off from there.
I like that too, because there is a lot that can be done at that state level. And then even understanding and introducing new skills around policy
Yes.
and regulations in nursing practice and the conversations that are happening in that piece. I will say too, if any of you are in your academic program, there are many faculty and even senior level nursing students who also want to grow, right? As nurses, we're
Yep.
lifelong learners and obviously caregivers in many of our personality styles. There's a lot of ways to do that too. And it might be even a faculty member who like you said, you've had some great faculty
Yeah,
along the way who have
absolutely.
encouraged you as you've grown through your program. So in your career, that's amazing. So now
And
I'm going to flip it
stay
to, oh, sorry, go ahead. Now you're going to
Yeah,
say.
well, you mentioned faculty. This brought up a key like memory and mentorship to me. Stay in touch with your faculty, even if it's your, freshman fundamentals faculty. If you really connected with them, don't lose touch. Stay up to date with them because you never know when you might need that relationship, where you might be looking for guidance, where you might be looking for a recommendation letter, or something like that. And it's much easier to make those sorts of connections and asks if you have stayed in touch versus trying to like dredge up, oh my gosh, I had Dr. Jones 4 years ago and she was great, but she literally hasn't heard from me. Dr. Jones has forgotten you. Let's be honest. She's had 300
She's got some
more
things on her
students.
plate.
She's got things on her plate. So stay in touch with these people.
Well, and how do you feel? Actually, I'm going to totally pivot it now to like LinkedIn. Like, I feel like I'm
Yeah.
telling a lot of new nurses, like, make a profile. There are so
Yes.
many nursing educators and leaders and innovators that really are showcasing a lot of their work on LinkedIn, which maybe for some, career professions that might be, a little bit of past their time, but nursing, we're holding steady to the LinkedIn
Yes.
community. I feel like that's another way that they can identify potential individuals that might be able to create a relationship with.
I completely agree with you, Kendall. When one of the presentations that I give is, so you want to be a nurse leader, now what? And one of the first steps is you got to make a LinkedIn profile. I feel like it's talked about in business school and other sorts of professions. And like, no one talked to me about that in nursing school. I have only had a LinkedIn for a few years, honestly. And I really have connected with some excellent mentors because I see, oh, Lori Armstrong is doing some amazing nursing leadership work. Like, I'm gonna ping her a message. Well, lo and behold, she was more than happy to jump on a Zoom call with me. And I never would have imagined that she had time for that. But she made time because she saw that, I really was striving for that sort of mentorship, and she was happy to do that. So yes to the LinkedIn. Don't feel like you have to go down the rabbit hole and commit tons of time and energy to it, but see who's out there and use it as a springboard.
I will. Well, I'll call us out, right? Like, that's how our relationship started, was
It
through
is.
a LinkedIn message, right?
Yes.
That's how we're connecting here today. So we are telling you, in and of itself, we do believe in LinkedIn. That's how we've connected as this this podcast came to be. But there is a lot to grow there. So then, if
Yes.
I am working as a nursing academic or a leader, how should I grow myself to become a mentor? Obviously, many of us are, a little burnt out, a little resource restricted, but how can I become a better mentor? What would be your strategies there so I can help develop or grow the nurses that I'm working with every single day?
Yeah, I'll say it all starts with listening to the students. Make the time for those face-to-face conversations. Maybe it starts with just some office hours. Maybe you intentionally reach out and set that expectation for your students on day one when they're joining your cohort or whatnot. It might depend on how many students you have and what your institution is structured, but tell your students like, hey, I do want to be your mentor. Let them know that that is your expectation, and it's up to them to then take you up on that, but they won't know if you don't tell them. And I guarantee you some of them will reach out, and then it's up to you to really listen, collate those themes from what you're hearing from your students, And that will inform, what you need to work on as a faculty member, things that, maybe we can innovate to help problem solve with these students, and so on and so forth.
Wonderful. So hopefully anybody who's listening, you can see that there is nothing but passion and excitement from Dr. Taylor around being a mentor. If anybody listening here today wanted to get in contact with you or learn more about your growth, the classes and conversations you're guiding and leading, what would be the best way for them to reach out to you and to connect with you for even mentorship potentially?
Absolutely. I love it. I am on LinkedIn, so you can find me. I'm Dr. Morgan Taylor on LinkedIn. You can also find me through our website, archerreview.com. We've got all of our listings and mentorship and contact info on the website.
Wonderful. Well, anybody listening here today, if you haven't heard it, become a mentor, be a mentee, grow your career, grow your profession. You may learn things you love. You may learn things you want to potentially keep to the wayside, but you're going to learn either way and you'll become a better version of yourself. So thank you so much for listening. Please share, provide comments on any other areas you'd like to see, including individuals like Dr. Taylor, who are really expanding the innovation, education, and the support in the nursing community that we need. But thank you so much, Dr. Taylor, for joining us today. And hopefully we'll continue to connect as we have our new relationship. Everyone who's listening today, have a wonderful day, and thank you to listening to the Debrief with Kendal Bailey.